I'm Dr. Rohit Shenoi. I'm a pediatric emergency physician at Texas Children's Hospital in the emergency department, and also a professor of pediatrics at Baylor College of Medicine in Houston, Texas. So, drowning is the leading cause of death, unintentional injury death in children in the United States. And for several years, there were declining drowning rates, fatal drowning rates in children. But there's been an uptick in those rates recently. And what we've noticed is that the disparities in fatal drowning rates affecting certain racial and ethnic groups, for instance, Black children, Native Hawaiian, Pacific Islander, as well as rural children, are disproportionately affected in terms of fatal drowning rates. No single method of drowning prevention is effective really in preventing all drowning. And so, what this policy statement emphasizes the need for multiple levels of prevention. And these include close, constant, attentive, and competent adult supervision of children in and around water, the need for four-sided pool fencing, in other words, isolation fencing with closing, self latching gates that fully isolate the pool from the home. Also, the need for water competency, which includes swimming skills, but also a knowledge of the risk awareness, the safe behaviors in and around water, the use of life jackets, and then also how to respond to someone in a safe manner in case they drown. Also, there's the need for life jackets, the need for using US Coast Guard approved life jackets, which are properly fitted by children. Children should be wearing this whenever boarding, and as well as those children who are weak swimmers as well, near water too. And then adults should model life jacket use as well. And then when drowning occurs, seconds matter. So there's really the need for early rescue and the emergency response, which includes resuscitation to save life. There were multiple reasons why there were these disparities in fatal drowning rates. For instance, there was limited access to aquatic activities and swim instructions for the population groups I mentioned earlier. There are also fewer community resources and aquatic venues too. There's certain restrictive policies pertaining to access, cost, and clothing for low-income uh, people, communities too. Sometimes there are fewer opportunities for single-sex aquatic setting as well. And there's variation in intergenerational swimming capabilities. These are related to historical racist policies which limited access to swimming. Also, there are prior negative swimming experiences and then shortages of lifeguards in underserved urban communities. So, what the AAP recommends is culturally affirming policies that encourage participation of people from diverse backgrounds in aquatic activities, expand the access of swim classes and aquatic venues, disseminate affordable and culturally appropriate water safety information and resources in multiple languages for local needs to peoples of all ages, cultures, and abilities. One special note is for children with autism, too. There's a need to have them enrolled in adaptive aquatic classes, which specifically help them in that aspect of drowning prevention. So the AP recommends that swim classes could begin after the child's first birthday. And the reason for this is that they have the motor skills in which they can be taught how to harness that and learn to swim. Swim lessons should be an enjoyable activity too, and parents are participating as well. And so that's what the AP recommends too.